This video is made by Cervical Cancer Prevention Foundation, and it is the information about cervical cancer situation in our country, India. Now, if we look at total number of cancers among all women in our country, there is a list on the left hand side where the cervical cancer is number one, followed by breast cancer, then oral cancer, so on and so forth. The incidence or number of cases, we see that for every 10,000 women in our country, almost 26.2 women, that is 26 women, are diagnosed of cervical cancer every year. If we compare this with breast cancer, the number is quite more as compared to breast cancer. There are 16 cases per 10,000 every year. Now, these are number of women who are diagnosed of cervical cancer per year. If we look at deaths due to cervical cancer, they are 14.7, that is almost 15 women out of every 10,000 women will die of cervical cancer, whereas the same figures for breast cancer are 9 women per 10,000 women who will die because of cervical cancer. So if we look at this, the chances or the incidence of cervical cancer is much higher than the breast cancer. Now, if we look at the age related or at what age group the cervical cancer happens, and also the mortality, the deaths due to cervical cancer. So in this graph, we see two lines. One is the yellow one, which shows the number of cases diagnosed depending on the age of a woman, and second line, which is the blue line, which indicates the number of deaths. So as we can see that up to the age of 40, 45, the chances are fairly less. And then from 45 to 55, it just grows up. And so is the not only the number of cases, but also the deaths due to this. So we can say that the maximum chances of cervical cancer happen after 40 years of age. One must remember that the precancerous changes happen 7 to 10 years in advance. That means the screening should ideally start about 10 years or more, so that is below the age of 30. So that's the time the screening is most important. Now, if we look at cervical cancer disease burden in our country as compared to the world, we can see that the new cancer cases diagnosed annually in India is about 1,32,000, whereas in the whole of the world is 4,93,000. So that means very high number, that is 27%, that is more than one fourth of the whole number of cervical cancer cases in the world are in our country, and so are the deaths. There are about 74,118 deaths recorded in our country in 1 year, that is 365 days. Now, if we look at the population of India, is about 12% of the world population. That means we can say that 12% of world population is giving rise to 27% of cervical cancer cases in the world. So that means we need to do a lot, and other countries are probably taking adequate steps to prevent it. Now, cervical cancer in India, we can say that more than 200 women die every day. That is 8 women per hour. That is shocking figure, is every 7 minutes one woman dies. Now, most important part is 97%. That is 97% of all the cervical cancers can be prevented if we take steps of screening. We will be talking more about screening and how to prevent it in our next video. But here the emphasis or the importance is that 97% of the cervical cancers can be prevented. Screening is very simple and very easy. Now, let's summarize some important facts which we can remember, that 27% of the world burden of cervical cancer is seen in India. Every 7 minutes, a woman dies in India due to cervical cancer. Cervical cancer is usually diagnosed in a late stage, and many a times when we see patients who are symptoms like bleeding or discharge or PV bleeding, they are in an inoperable stage. Cervical cancer screening is recommended in all women. Most important is the good side is 97% of the cervical cancer can be prevented if proper screening is followed. Precancerous changes happen 7 to 10 years in advance, and that's why we have plenty of time to do it. But important thing is we need to do it.